7:53 WBCK, Richard Pyatt Show, Tuesday. And if you have pain in the knees or in the hips, then Dr. Joe Burkhardt, Bronson Orthopedic Specialists, has something you may want to hear. And he's here to talk to us a little bit about that. It's actually a presentation coming up soon called New Knees and Happy Hips that will happen March 17th in Marshall, and we'll give you the details of that, but we'll talk a little bit about it now. Good morning, Dr. Joe.
Good morning.
Happy to have you here with us today. This is a common issue, isn't it?
It really is, yes.
So when, or I should say, we'll start with what the causes or some of the symptoms are involved with this pain in knees and the hips. What is at the root of that?
Well, there are two major branches of that. There's the most common is wear and tear, just
using it,
aging, and then the secondary cause is your own body attacking itself, and that's like rheumatoid arthritis or lupus, those sorts of problems.
Mm-hmm. All right. So, what treatments are available to deal with that?
Well, initially we try to start with conservative things. Most commonly, non-narcotic pain relievers like Motrin and Advil and that kind of thing. And then we move into injectable treatments. And when all that fails, we move to surgery.
So most often, then, this is a progressive thing. You're going to start with those anti-inflammatory painkiller type over-the-counter stuff, and eventually that's not going to be enough.
Typically, and we kind of modify that treatment based on the degree of disability the person's going through.
Okay, makes sense. So can you talk about knee and hip joint replacement? What's involved in that? And at some point, it probably becomes a consideration for some folks.
Yeah, it's a procedure that's been around for quite a long time and has evolved significantly over the years. The materials we use are inert within the body, and they involve metal and a polyethylene cross-link structure that's very durable. And the metals are typically titanium, cobalt, chrome, or oxinium. And we remove the bad area of the worn joint, realign it, and replace it with an implant.
Wow. Talk about technology evolving. That really sounds like an example of that. It's changed a lot.
It has changed. The way we implant these devices has changed a lot. That's really where the change has been.
So if somebody is looking at a replacement situation like that, you're going to take care of that. What's the recovery time generally?
Recovery, it's kind of like the common cold. When people ask that question, I use the common cold as an example. Some people, that lingers on for weeks. And some people are able to continue on with their job, and they don't miss a beat,
Wow.
So it's different for everybody. In general, the short-term recovery can, and that's how quick are you back to getting in your car and driving and things like that.
Yeah.
Probably in the range of 2 to 6 weeks, and then you improve for a whole year after that.
Wow. So after that year goes by, are people as active as they were before?
Many people are. Many people get to the point where they stop thinking about their knee or their hip.
That's a signal then, isn't it?
Yes.
Yeah, if you're running around with pain in the knee or the hip, then that's on your mind all the time.
It is, and it's very debilitating.
So the special session that you're going to have, New Knees and Happy Hips, that's coming up on March 17th. Who should come to that?
It's open to the public. It's free. So anybody with hip or knee pain that wants to know more about what the new technologies are out there, robotics, customization, and implantation, that's what we're going to be talking about.
So if folks undergo that kind of replacement that we talked about, do they see you again regularly after that? Or is your experience been that folks go back to a routine and they just check in with you somewhat regularly?
People go back to a routine. Initially, they see me quite a bit in the beginning, and then we usually will do a 1 to 2 year follow-up. It's kind of like checking your tires.
Yeah, right.
Make sure everything's good, and that's an elective thing. It's not an absolute, but that's what we try and do.
Boy, that sounds like a lot of folks can get back to a routine they enjoyed before with this technology. That's great.
They can.
So if this intrigues you, New Knees and Happy Hips will be a presentation that Dr. Burkhardt will bring to the Maplewood of Marshall on March 17th at 4 p.m. That's a Thursday. Do you need to register in advance? Yep, you do, actually. In fact, bronsonhealth.com/classes would be an easy way to do that. Or you can call them, 800-451-6310. And that program, again, is free and open to the public. And Dr. Burkhardt will give an overview on knee and hip pain. And following that, there'll be a Q&A. So I'm not the only one asking the questions. You can ask them, too, and Dr. Joe will be ready to answer those. Again, it's bronsonhealth.com/classes, or call at 800-451-6310. And you can get information, too, as well at bronsonhealth.com. Or you can call directly to the Bronson Orthopedic Specialists office and make an appointment to see Dr. Burkhardt directly. Thank you.
Thank you.
All right. We'll look forward to further sessions of this nature. And New Knees and Happy Hips, again, happens on March 17th, Maplewood of Marshall. 7:59. Well, plenty cloudy out there.